Hello, Mr. Collins.
Yes, sir.
Hey, I'm Kelly. I'm one of the clinicians here. Can I go ahead and get your date of birth from you?
Yes, sir. It's 1/1/1970.
Okay, perfect. Okay. I'm one of the clinicians here at the hospital, and I understand that you came in with some minor groin pain today. I want to talk to you a little bit more about that and get some history from you. Is it okay if I have a seat here?
Yes, sir.
Great. So, just excuse my papers here. I'm going to write down a few things that I can put in our computerized patient record system. So tell me a little bit about what's going on today. Where's the pain?
It's kind of like right on the side of my groin.
Okay. All right. Tell me what you do for a living.
Well, I work in a supply warehouse.
A supply warehouse. And what do you do there?
Mostly I handle supplies. I move when boxes come in from the shipper. I move them and put them on the shelf, and then whenever they go out to the wards, then I pull them off the shelf, put them on a cart, and take them out and stock the supplies.
Okay, so it sounds like a lot of heavy lifting. Is that right?
Yes, sometimes.
Okay, so your job requires a lot of heavy lifting. Okay. Any other stress or strains? Any other stressors that make that area happen?
Sometimes it's hard for me to have a bowel movement.
Okay.
And if I strain a lot when I'm doing that, it starts to hurt.
When you have a bowel movement and you have to strain?
Yes, sir.
How often are you having a bowel movement?
Usually about every day or every other day.
Okay, all right. And you've been drinking well, taking in fluids?
Yeah. I do okay. It gets real hot at work because we don't have air conditioning.
Okay.
So I do drink probably one of those bottles of work of water per shift.
That's great, and I want to go ahead and encourage that. If you are having trouble having a bowel movement and you find yourself straining, one of the things I would recommend is increasing your fluid. Another thing we can do is a fiber-rich diet. I can give you a handout on that, and we also have some resources available on our website. Getting up, moving around a bit more. If you want to increase your physical activity, maybe do a walk every morning. It doesn't have to be major cardio, but just getting up and moving around a bit more can help stimulate that. So it sounds like you can get on the right track. So heavy lifting, sometimes you're straining when you have a bowel movement. How's your urine output been? As far as have you been peeing okay?
Yeah, it's been okay. Sometimes it's my urine it's dark and it's got a strong smell.
It's a strong odor?
It smells like pee.
Okay,
a lot.
sure. So, okay, do you think you'll be able to produce a urine sample for me today?
I can.
I want to get a urine sample, and then I'm going to ask the doc to see if we can get a little bit of blood work done. Some of the things that can be associated with your kidneys that are part of the urinary system can be a BUN level and a creatinine, and those kind of just let us know about the function of your kidneys. There's a filtration rate factor we can look at with the blood. So if you don't mind today, I'm going to ask the doc about getting some labs. So we'll have the multi-skilled tech get the lab work for us. Okay, and let me see here. Can you tell me a little bit more about, okay, when the pain comes, is it sudden onset or does it just hit you out of nowhere? Kind of hurt all the time?
Well, it's sore all the time, but sometimes it gets worse, and then it gets, sometimes it gets really bad, but usually, like if I just take it easy for a little while and like go to bed or
Okay.
sometimes when I wake up in the morning, it's kind of better.
Well, what I might be thinking is to maybe do a little bit further of a focused assessment on what's called a hernia. An inguinal hernia sounds like it might be your issue. Or have you ever heard of that before?
Yeah, I've heard those words.
So in the inguinal area is an area where the veins, arteries, and nerves that descend from our abdomen down to our leg has a small hole there, and it's usually pretty tight and just lets those vessels through. But sometimes abdominal tissue can push through there, and we don't expect to find that. A lot of times males will find a lump in the groin area.
Okay.
Have you noticed anything like that when you're showering or anything?
Sometimes if like it hurts really bad, it does feel like I have a knot or a lump.
Okay, that's something I want want to take a look at. You know, there are a couple types. We have a direct hernia, indirect. There's also a strangulated as well as an incarcerated. The strangulated is going to be majorly painful. It is dead tissue, necrotic tissue. It's a pretty advanced form. Usually with that is horrific pain. So the traits that you described about yours, I think we can just do an assessment. And I might look to the doctor to order a CT scan or an ultrasound. The ultrasound is where they come in with the gel and just do some sonography. It'll show images. And then of course the other option is a CT. You do have some of the risk factors as well, being a male, the heavy lifting, straining, as well as do you have a history of having any inguinal hernia before in the past?
Not that I know of. I've never been told that.
Okay, that can be a finding as well. Okay, and when I wanted to go ahead and get the urine sample in the blood, but I wanted to ask you with the frequency of your urine, if you get to where, we talked about already encouraging the fluid intake, if you get to where you're not making any urine at all, or making, you know, probably less than 8 ounces in 8 hours, we probably want to check that out. Or if you find that you're having extreme amounts of urine more than normal, can be an early sign of diabetes. So, you know, a liter over the course of 24 hours is pretty normal. So if you find any new findings related to that, we want to check that all out. But for right now, I want to go ahead and do the focused assessment. So if you can, we'll have you just hop up on the bed here and we'll do the physical part of the assessment, okay?
Okay.
All right, thank you. All right. I'm just gonna step here and wash my hands real quick. Okay, Mr. Collins, so I've washed my hands here and I'm gonna go ahead and don my gloves. Okay, there we are. And I'd just like to pull the sheet back for a moment, if that's okay. Do you have your consent to do that?
Yes.
Okay, we'll just pull that back. Now lift your shirt here. I'm going to lower your pants just a bit here. And I'll drape this here. So what I'm going to be doing here, Mr. Collins, is checking in the inguinal area. What I want to do is lay my 2 middle fingers along the inguinal edge, and then proximal to that, I'm going to put my forefinger, and I'm going to be feeling for a bulge. And the first thing that I want you to do is, I'll assist you here, is just lift your head forward for me. Great. And do that again. Okay, good job. And did you say that was the left side or right side that was giving you the most problem?
It's the right side.
The right side, okay. We're gonna go ahead and do one more test. And what I wanna do this time is I'm gonna keep my hands in the same position. Right here we have a proximal and a distal loop that the testes descended through, and that's the same area that the nerve and the vein and the artery flow through. So I'm gonna keep my hands on that position. And what I want you to do this time is cough for me. Okay, great job. And I want you to just do one more cough for me. Okay, so one of the things that I'm noticing is my 2 middle fingers rising. So when these 2 fingers rise, can maybe let us know that there might be a herniation. I do also feel a bit of a bulging area as well. So with the coughing assessment is oftentimes when we'll find this. So I definitely want to stick to the original game plan and look to maybe asking the doctor about having a CT or doing an ultrasound. And let's see, it looks like the nurse just brought back in the urine sample here. And as we were talking about before, this urine sample seems like it's a little dark, a little concentrated. So if you're sweating a lot whenever you are moving boxes in the warehouse, that can lead to dehydration. If you're drinking 1 bottle of water per shift now, go ahead and encourage it to 2. And then, let's see, we can also, like I said, get you moving around a little bit more, and the doctor may want to get you a stool softener. I'll go ahead and do the same assessment on the other side. Just because we might have located one, I'll see if it would be needed on the other side. So I'm just going to switch here. And I'll do the same thing with the positioning of my fingers here. Okay? And what I want you to do is go ahead and lift your head for me. All right, I don't feel anything. And then if you'll just go ahead and big cough. And one more big cough. Right, and this side, I don't feel any type of lump or on this side at all. I don't feel anything abnormal. So I do think that it's probably the right side that's affected. So I will go ahead and send your urine to the lab sample. We're gonna order blood, and we are going to get you some imaging scans. I want you to take the dietary recommendations that I've made, definitely. We will also, if you wanna go ahead and get up here for me and take a stand, Mr. Collins, I'm gonna give you some resources to take home with you, and we have some internet resources that I'll talk to you about. So I'll give you these, okay? And then you said you work in the medical field, right?
Well, I'm a supply,
Okay.
I'm a supply tech at the hospital, yeah.
If any of that is difficult for you to understand, feel free to call us, and here's a little pocket card for you. And
Okay,
I'm gonna have you follow up within a week, okay?
okay, thank you.
Thank you, sir.